Hello everyone, my name is Dr. Sikandar and today we will discuss about the tree in bud appearance in chest CT. So let's start. So yeah, they are telling like bronchioles refers to terminal passageway for gas exchange in the lungs. They are not normally seen on CT scans due to their small size. So yeah, terminal passageways are like very narrow in size. They are like either less than or equals to 1 mm. However, in the presence of disease process which involve the bronchiole, like infectious or inflammatory conditions, they can easily be identified among the many patterns used to describe diseased bronchioles. The most recognized is tree in bud appearance. It was initially used by JGIM to describe the endobronchial spread of Mycobacterium tuberculosis. So yeah, tree in bud appearance first described for endobronchial spread of MTB. However, since its first use in 1993, the tree in bud pattern has been associated with multiple etiologies. It means like it is having multiple etiologies, but first it was described for endobronchial spread of Mycobacterium tuberculosis. Yeah, they are telling like it used to show these bronchioles which are like 1 mm in size, but they are filled with mucus. That's why, or their wall is like thick, or like because of any inflammatory process or infection, they are filled with secretions or mucus, anything. Because of that, they appears like they used to be visible in CT scan. So these all are tree in bud appearance. Very important. Here we can see. Yeah. Then they are telling about the histopathology. The tree in bud appearance seen on CT represent radiological sequel of infectious or inflammatory process. Very important. Generally, these often result in bronchial wall thickening and replacement of normally air-filled lumen. Normally, it is filled with air, but now here it will be filled with mucus or pus. As a result, involved bronchiole are more conspicuous on CT imaging. The tree in bud appearance has been linked to finger in glove appearance and in children's Toki Jacks like appearance. Figure 1 in CT scan of a patient with tree in bud appearance with a representation circle. Here we can see this is like a tree in bud appearance, and they are telling figure 2 is drawing rendition of tree in bud, like how tree in bud appearance looks like. So this is drawing rendition of tree in bud. Very important. These all are tree in bud appearances. Then what are the differential diagnosis of tree in bud appearance? The differential diagnosis for tree in bud pattern is extensive. So there are like multiple causes of tree in bud appearance, and it include infection, congenital conditions, neoplasms, or idiopathic causes. So here we can see like in infection, it could be due to tuberculosis, bacterial infection, viral infection, fungal infections. It could be due to aspiration. Very important. This is the important cause of tree in bud appearance, aspiration. Then congenital disorder like cystic fibrosis and Carter-Jenner syndrome. Then idiopathic condition like obliterative bronchiolitis and diffuse pain bronchiolitis. Then comes immunological causes like allergic bronchopulmonary aspergillosis, ABPA. Then comes connective tissue disorders like Sjogren syndrome and rheumatoid arthritis. Then comes neoplasm. So they are telling like in respiratory infections causes about 72% of like these. They are telling like it is respiratory infection cause about 72% of cases, which are having like 39% of them are due to mycobacterial infection. Very important. So like most of the cases of this strain bud appearance are tubercular only. 27% are due to other bacteria, 3% are due to viruses. Mycobacterium avium complex is the most common cause in most series. However, the classic cause of tree in bud appearance is Mycobacterium tuberculosis. Very important, especially when it is active and it is contagious and associated with cavitatory lesions. Aspiration is also common cause of tree in bud appearance. It is important for clinicians to remember that this pattern has an extensive differential diagnosis when evaluating a patient. So that's it all about tree in bud appearance.